As we all know, the world around us as we know it is quickly changing due to COVID-19 and its implications on Canadians' health, the economy, and our social infrastructure. Canadians are left with so many unanswered questions. So today we're talking to Honorable Michael Tibollo to bring you some important information for you and your families. Now, we've heard the term social distancing and isolation a lot, but there's a lot of Canadians that unfortunately don't have the liberty to take days off or work from home. How should we change our behavior if we still have to follow that day-to-day life?
Well, the first thing I want to say to the people watching us is that this is a serious issue that if we take proper precautions, it's something that we can get under control. So when we talk about social distancing, it's basically maintaining approximately 2 meters of distance between each other. But in addition to that, the simple things like washing your hands with soap and water. If you don't have access to soap and water, to utilize, one of the cleaners, the disinfectants that are available. To also ensure that you wipe down surfaces that you typically would touch, so door handles, handrails, or if you touch them, make sure that you wash your hands afterwards. The use of Kleenex, lots of times people will use a Kleenex more than once. Well, the best thing to do is to throw it away. There's no shortage of supplies in the province of Ontario for paper towels, for Kleenex, and for toilet paper. Lots of toilet paper. So there's no need to worry about those types of things. It's still possible to interact with people. It's possible to go shopping. It's possible to go to the pharmacy to pick up your medications. Life can be lived normally. Just respect the distances that we've asked to respect, and stay out of crowds of more than 50 people. If we do that, we can make a huge difference in terms of flattening the line and not continue to see increases every day with more people infected with coronavirus.
And you mentioned pharmacies, and I think there's a lot of concerns of people thinking, should I refill my prescriptions to a long term? How should we handle that situation?
And again, that's an important question. What we've been saying is 30 days supply of any medication is ample supply. There's no need, again, to go out and buy 6 months or a year's worth of supplies. Same thing with toilet paper, same thing with paper towels, fruits and vegetables. Obviously there was a bit of a run in terms of people panicking or being worried about it, but there's nothing to be concerned about. There's lots of supply in the province of Ontario. With the pharmaceuticals and basically the essentials that you need for life. The grocery stores are going to remain open, the gas stations are going to stay open, the pharmacies are going to stay open, and there is supply.
And I think there's also a big concern with how accessible tests are. People think that perhaps they could have the virus, they could think that their family member has a virus. How accessible is a test to Canadians? And if someone at home perhaps thinks that they could have gotten the virus, what should they do?
Well, today we declared a state of emergency in the province of Ontario. We also talked about injecting $100 million into the medical system to make sure that there are more beds available for people that are critical, more beds for people that are sick within the hospitals, to make sure that we have ample supplies of masks, gowns, cleansers, to make sure that basically the system is able to operate. So if a person thinks that they may have the virus, don't go to the emergency room of the hospital. There's a self-assessment tool that can be used. There's telehealth where you can have a live person interact with you.
Should they call 911 before I?
Absolutely not.
Okay.
This is not unless it's a 911 emergency that a person is having difficulty breathing and it's gotten to the point where they need that kind of emergency intervention. Otherwise, if you do a self-assessment, you speak to someone at telehealth, you'll get direction to one of the testing centers. And that's why it's not good to call 911 or, for that matter, go to the emergency room at the hospital. Best thing to do is to speak to the appropriate person, get sent to the appropriate place. We also minimize the risk of infecting people in our hospitals. Do that. You'll be tested, and the results will be told to you as quickly as it takes to incubate. But the reality is that we can do this. In the interim, stay at home, wait to get the results, and then you're in a self-isolation situation for 14 days. Use those 14 days for positive things, because we don't get many opportunities to actually spend time with ourselves. So utilize the time to find out more about who you are, what your interests are, and perhaps even pursue that hobby that you've never had the time to pursue.
Absolutely. And now we've seen, unfortunately, in countries like Italy, in countries like China and Iran, where perhaps people don't take it seriously and the health system collapses and hospitals and ICU units are completely full. Is Canada prepared to take on a situation where thousands of people need that intensive care?
Well, by issuing a declaration that we're in a state of emergency, what we've done is we're reacting to the need to ensure that we can flatline the increase in demand on the hospital system. Rest assured that we are taking every precaution to make sure that the people of the province of Ontario are safe. That means that we're making sure we have provisions necessary to look after individuals. It means that we're looking at capacity and strategies in terms of what needs to be done if and when something like that happens. But one of the things that I want to assure people is that the situation is being well managed in the province of Ontario. Our chief medical officer for the province is in tune and watching what's happening worldwide. It is not at the point where we are anywhere near what's happening in Italy and some other countries. And the system is working. The only issue that we have to make sure is that people understand, especially, when we talk about, the ethnic communities, this is a serious matter. It's not something to be taken lightly. The fact that we are asking people to wash their hands, while it may sound silly, that's how it's transmitted. And maintaining the distance, as much as that may sound silly, being Italian, one of the first things that I always do is kiss on the cheeks. With man or a woman, that's the way we say hello. But it's something that we now have to reconsider, at least until we have this coronavirus under control, because it's the saliva and the chances of that spreading to another individual through the nose, through the mouth, through the eyes. So let's be safe. Let's maintain and respect what is being told by our public health officers. And this will pass because, again, we're taking the proper precautions and doing what's right.
And a lot of things are scheduled to supposedly come back end of March, mid-April. Is this something that you guys at Queen's Park are seeing as something that is long-term, or is it more of a short-term problem that we can hopefully get under control?
Well, we're working diligently as a government to make sure that we take all precautions and implement them on a timely basis as a result of what we're being told by the World Health Organization and by our chief medical officer for the province. There's a coordinated effort that I'm sure you've seen between all the municipalities as well and all the local councils. All of us are working together at every level of government to make sure that we get this right, because at the end of the day, by keeping people healthy, the economy will restore itself that much quicker. And that is obviously a concern, not only the health part, but that we continue to have an economy that's working in the province of Ontario.
Absolutely, and of course there's a lot of people that unfortunately can't go to work, or there's no events for them to work at, and perhaps economically they're going to suffer as well. Will we be hearing anything soon about things that the government can do to help those Canadians that have mortgages or rent or kids and unfortunately have lost their means of income?
Yeah, and that's obviously a huge concern for us as a province, as it is for all levels of government. For us, what we've done is, and we've worked with the federal government, I'm sure you're aware that there is no qualification period for UIC anymore, so that if you're in a situation where you have to be at home to care for a child, or you're in a situation that you can't work because of the quarantine period or because of the coronavirus, there is no requirement for a delay with respect to applying for and receiving UIC. With respect to a lot of the work that's being done in a lot of the industries, especially the hospitality industry, it's been really wonderful to see the fact that a lot of these organizations are looking for ways to help their employees. We're working with the federal government looking for additional ways that we can help citizens of the province of Ontario. And again, our health and safety is priority number one, and we have to ensure that that's taking place. And we will continue working to find ways to help people, manage their financial affairs during this difficult period.
Of course. And now lastly, I do know that you are the Minister of Mental Health and Addiction, and there are so many Canadians that do suffer from mental health issues, and they rely on their routines, they rely on things to keep themselves sane, and the thought of lockdown or isolation for people with depression or anxiety can obviously be a very scary thought. What can they do right now?
Well, the government of Ontario takes mental health very seriously, and we always say you can't be healthy if you don't have mental health. So we have made an investment and are in the process of continuing to invest $3.8 billion over the next 10 years in mental health and addiction supports. From the standpoint of mental health, we recognize that 1 million Ontarians right now go to a doctor every year looking for supports for mental health and addictions. So we recognize that there's a need. And the investments that have been made and that are continuing to be made will provide supports, whether it be Mindability, which is a cognitive behavioral therapy that can be accessed through the family doctor, can be accessed through telehealth, will provide some supports with respect to depression and anxiety. For the younger adults and kids, we have the ability, over the age of 16 actually, we have the ability right now to provide them internet-based cognitive behavioral therapy. There are therapists that are available that can be reached online or by telephone, which is, again, another possibility for help. And the other thing, too, is an individual can help themselves. It's important to not break all your routines. So if there's the opportunity to go for a walk, go for a walk. If there's the opportunity to go to the grocery store to pick up some groceries and you're healthy, then go to the grocery store. If you're at home, there's opportunities for you to establish a new routine for the period of time that you're at home. And that could be anything from, sitting down and preparing a breakfast to preparing a meal to reading a book. Some of our Italian and Spanish friends may want to be planting their seeds because soon the gardening season will open. So, why not do that and spend some time preparing your seedlings for the spring? It's important to establish routines when you can't keep the old routines. And that includes, again, doing the kinds of things that you can do by yourself. So read a book, watch a movie. TLN is a great place to go to. They've got great classic films. I watch a lot of that late at night. But there's opportunities like that. So maybe catch up with on a good book, catch up with a good movie, talk to your friends on the phone. If there's old people that live in your neighborhood and they're okay, but they can't get out because they don't have the means to get out, knock on their door. Go buy them a quart of milk. Go help them, make their lives a little bit easier. And again, our seniors have that issue of isolation.
Absolutely.
So if you can help a neighbor by being there for them, getting them a loaf of bread or whatever they need, talking to them, let's be a little friendlier with each other. Maybe this, we have to look for that silver lining in a very difficult situation. And maybe that's what the silver lining is here, that we need to do a little bit more and remember our humanity. Because at the end of the day, we're all brothers and sisters on this planet, and it's important that we look after each other.
Exactly. I mean, this is a time to isolate ourselves and social distance ourselves in a certain way, but find a way to stay together, because being together is the only way that we can all overcome this.
Absolutely.
Well, thank you so much for joining us. I know this can't be easy for all of you hard at work and for everyone at home. For now, I guess just follow the precautions that the government is giving you and keep your family safe.
Thank you, and I appreciate the opportunity to speak about this and reach out to your viewers to give them some ideas. Don't despair. There's hope, and adverse times always make us stronger and better. So let's use this opportunity to do that.
Absolutely. Thank you.
Thank you.
Thanks for watching, and remember to continue to monitor any updates or information brought to you by the Ontario or Canadian government to ensure that you and your family are taking the necessary precautions during this difficult time.